Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. Hi, everyone. Today, I am thrilled to have Dr. Mike Osterholm back on the podcast to talk about COVID, where we're at. We last spoke in July of 2020, so about 9 months ago, and a lot has changed. Dr. Mike, I should say. Mike, you are still an infectious disease epidemiologist. You are still at the University of Minnesota. But since I saw you last, you also were part of President Biden's transition team. Tell me a little bit about that.
Well, I feel very honored to have assisted the administration in the transition from having been newly elected to actually setting up government. So it was really an opportunity to give what I could to this amazing group of people that were assembled that really laid out all the issues that we could imagine with COVID-19 and made sure that the administration had them all on the radar, made sure that there were plans to address them. And although we basically went away officially with the inauguration, since we're not a standing federal advisory board, we actually still continue to meet weekly and do provide input into the administration. And it's been a really a wonderful career gift to work with these people on this board. It's been remarkable.
I have to admit that since we last spoke, actually, since you guys had your last election, I kind of stopped paying attention to what was happening with you guys because I felt like, okay, you're in better hands now, sort of, and now let's concentrate on what's happening in Canada. And so I feel like the US is doing so much better because I hear about all these vaccines. Is that the case?
Well, let me take a step back and just say that, how should you measure whether an administration or any organization is doing what they can and should? And I would say over and over and over again, one of the ways to assess that is what is the currency of the decision making? What makes or why decisions get made? And I have to say that I have been very impressed that this administration has really used science as the basis for how they make decisions. It's the currency of the day. And so it wasn't just some rhetoric. It really has been science. And so from that perspective, I feel like any problem that we've had to deal with has really been encountered with science. I think the second part of it is that there has really been an effort to be transparent. We're facing that right now with the J&J vaccine in the United States and this serious problem we have with basically the blood clots. And some people would argue that, well, with 6 cases out of 6.1 million doses administered or more, is this really a big deal when we see that for those women who use oral contraceptives, they have 40 to 80% or 40 to 80 times higher risk of having one of these same clots? Are we scaring people needlessly? And the administration came back over and over again and said, we've got to be transparent. Everybody has to know what we're doing, how we're doing it, why we're doing it, and then let them make the decision. And I found that very refreshing.
Well, I do too, because I've seen all that, rhetoric online about that. And I've thought about it myself too, about the blood clots. And, if I was offered that vaccine, would I take it? I would. Like many other women, I risked blood clots many times in my life, and nobody seemed very worried about it at the time. But so I do respect that. And I feel much better when we base things on science and we have transparency. When you look at Canada, how do you think we're doing?
Well,
Be honest. I want you to be really honest.
Listen, this is one of the reasons I hope you have me on here, because that's what I do. I just try to call balls and strikes. That's it. I think that on a whole, the Canadians have approached this with also a science base. However, I wish that they had more in the way of vaccine manufacturing capacity and vaccine availability. The challenge that you're experiencing right now in the eastern part of the country with COVID-19 and what we call B.1.1.7 variant, which is one that is much more highly infectious and likely to cause more serious illness. And you're dealing on the West Coast with a variant called P1, one that was first discovered in Brazil, which likely has both the ability to be more infectious and cause more serious illness, but even more importantly, has the ability to evade the immune protection from having been vaccinated or naturally occurring infection and immunity. In both cases, I wish you had a lot more vaccine. Your vaccine efforts have been far, far below ours. And so that's, to me, has been the big challenge.
Let's talk about the vaccines for a second here, because I'm just seeing so much vaccine hesitancy, like more than ever before. And so when you talk about the J&J, and there's been 6 blood clots in what, 6 or 7 million? I mean, that little bit of information plants fear in people that already had fear, yet it just spreads so much and it causes that one little. All these vaccines have been so rushed and they haven't been tested, and there's no idea if they're even going to work. What do you say to people like that?
Well, I think first of all, we have to meet people where they're at. And so we owe them explanations for this. And the one thing I think that was a mistake about how this vaccine was rolled out was the fact that it was basically put together under a program called Operation Warp Speed, which right there by its name surely does not engender this warm, fuzzy feeling of this is a vaccine that was made for me safely. Second of all, we had Army officials, military, involved with overseeing its manufacture and distribution, which may give me reasons to have pause about just how much I might have faith in this vaccine. And in addition, as anyone following American politics knew, back in November, there was a suggestion that there may be a political thumb on the scale of what got approved and didn't approve. It was not true, but people might believe that. Then it was made largely by a thing called messenger RNA, which just fit many people's understanding of what someone was trying to do is get a chip inside of people. We're going to monitor you yet, okay? Without any understanding of the fact that this messenger RNA technology is something we've been using for cancer vaccines for more than 20 years. It's something that we have spent a great deal of time on looking for other infectious diseases. And it, to me, represents kind of you might say, a modern mobile phone technology jumped from what was the old crank telephone on the wall in the home, that the voice sounded the same through both of them, but oh my, is there a difference in technology. So we haven't done a good job of explaining what these vaccines can do. We today want to make sure that everyone knows that the risk of these blood clots in the brain, if you compare the risk of someone getting COVID and having the same things, there's over a 40 times higher risk of getting COVID and having that same thing happen than from the vaccine. Now, maybe that still isn't going to be convincing evidence, but I think it's at this point we have to do our best to understand what people are concerned about, why they're concerned. I can tell you right now, if you're a pregnant healthcare worker fearful of getting the vaccine, you have a very different concern and motivation than does a young black man in parts of this country where they have every reason to distrust what has happened in the past with government programs, to someone who might be working as an immigrant in a meatpacking plant here in the United States is worried somehow this will impact their status as being here in the United States. So every one of these is different, and that's our job. Our job is to figure out how to get people connected to the vaccine and help them understand nobody wants to be the person who dies 3 days before they were scheduled to get their COVID vaccine.
Yeah, it's so layered and complicated because it's not everyone has access to information that is true, scientific information. I mean, I know so many people that just get their information on social media. So that's, a lot of people. There's a lot of information out there that is not true and it's fear-based. Do you believe in herd immunity? Like, will we get there without everybody getting vaccinated? Is that what's important here?
Well, let me just back up and say, first of all, I think you've done a very nice job of laying out the concerns we have with misinformation or in some cases intentional disinformation. And, you've seen it here in the United States. We've actually had people disrupt vaccine clinics so they couldn't occur. Now, I mean, that takes it far beyond just leaving a choice to myself to get vaccinated or not, and what information you give me that may not be correct, but it's your way of persuading me not to get vaccinated. To take it to the point of actually stopping vaccine clinics is really remarkable. So I think we do have to deal with this issue in a very, very real way, and it has to be culturally sensitive. It has to be age sensitive. And then on top of that, we have to make sure that people understand how to get the vaccine. If you're an inner city member of the community of color, 75 years of age, homebound because it's maybe dangerous to go out in your neighborhood, you don't have access to a computer, you think you're going to have an easy way to get that vaccine scheduled? No. Are you going to be able to get there in a relatively easy manner? No. And so one of the things we have to do is even look at the fact of who can even get to a vaccine if they want it. And I think that's true across the world. We have to look at, number one, first having people feel comfortable why they should get it, sensing the urgency of what this vaccine can do to protect them. And number two, making it possible for them to get the vaccine. The final piece that I worry about very, very much, and have since November, when these variants of concern, the ones I just talked about, the ones that either are more transmissible, cause more serious illness, or can evade immune protection, if you look, where those are going to spin out new variants, ones that are even potentially going to be more complicated and difficult to deal with than the ones we have now, is going to be in the low and middle income countries where the virus is largely going unchecked. As of this week, 10 countries in the world have had access to more than 84% of all the vaccine. That's it. Oh. Many countries don't see the vaccine coming for a long time to come. And so we've got to, through what's called COVAX, a program put together by the World Health Organization that includes governments, it includes the philanthropic world, other working related groups. It's no longer enough to say, well, we'll get 20% of the low and middle income countries vaccinated in the next year as a humanitarian effort. And you could argue we should be doing 100% as our goal. But now we must have 100% if all possible because of these new variants. And if we're going to protect the vaccine of Canada, we're going to protect the vaccine of the United States or Europe or any of the high-income countries, we now have to understand we can't let this virus go unchecked in low and middle income countries because that's where these dangerous variants will spit out from. And they'll be in our countries in no time. And so to me, this is the real challenge we have. It's not just in our own backyard getting people vaccinated. That's critical. That's obviously critical. But it's also critical to get people vaccinated around the world.
Okay. Oh, boy. Yes. Because it's not just what's happening in our own backyard. It is what's the viruses, as you explained when we spoke 9 months ago. I mean, they just hop on a plane now. And that's how this is how it happens. So let's talk about these variants and children. Kids are in school here in most parts of Canada. I think Ontario has suspended it right now. I don't know what's happening in every state in the US, obviously, but I know that we've been back and forth. But it's always been here where I live in British Columbia. It's always been, kids are safer in school than they are at home. And that it's not, we don't have to worry because it's not airborne. So you don't have to worry about your kids being stuck in a classroom. So can you talk a little bit about kids and their safety? Because with these new variants, we're seeing it show up in lots of kids, are we not?
Yes. Well, let me first of all just say that I have a very personal interest in this. I have 5 of the most simply wonderful grandkids you could ever imagine, from ages 11 to 3. And they mean everything to me. So, I'm going to obviously look at the science as carefully and as completely as anybody could do. And if you take a step back, when you look at what had happened in our schools with in-school learning, I mean, I'm in the classroom, it was clear that for K through 8th grade, roughly we saw very limited transmission between kids, to kids, between teachers, to teachers, and it was, in a sense, what we almost call an anti-influenza model. And what I mean by that is if you want to follow influenza transmission in our communities, those of us in the infectious disease area that work in this problem know that as soon as you see it blow up quickly in schools, particularly in that younger age group, you're about a week to 10 days off from when it's going to blow in the community. Because these kids are just like little virus reactors. They are very efficient at transmitting the virus. Well, then along comes COVID-19 and the virus SARS-CoV-2, and we didn't see that level of transmission. And so I was one that was strongly supportive of saying we can probably get these kids back safely into schools. And not because of things we're necessarily doing. In fact, airborne transmission is very important yet today. But for some reason, these kids are just not that infectious and not infecting others. Well, that turned its on a dime in November when we saw these new variants emerge. Remember, variants are just viruses that have mutated. We've had many variants of this virus for the duration of this pandemic. But what's happened is in the last 5 months, we've now seen variants that before were just kind of interesting markers like the color of a car and not at all affecting the way the virus interacted with us, to seeing now these variants of concern, which do fall into the buckets of more transmissible, more serious illness, or evading immunity. And all of a sudden, we see B117 show up in England. This is a virus that put out 50 to 100% more infectious than the previous strains, causing more severe illness. Well, that arrived here. And that has fundamentally set on its head all of our recommendations around school-based activities. This virus is highly infectious. And in fact, right here in Minnesota, we have had 790 schools with cases, 80% more or more having outbreaks just in the last 2 weeks. And we're one of those areas right now in the United States seeing rapidly rising cases. Now, what's really telling about that is if you look at those 790 schools, that almost approximates the number of schools we had involved when we had a really big surge back in October, November, a really bad time period. And we're going to blow right back by that now, given what's happening here, far higher than we saw even back in November. But what's very telling is that back in November, about 20% of the schools actually had outbreaks that had cases in them. So many times a kid could show up in school infected, and that was the end of it. Now we're seeing over 80% of all the schools in Minnesota that have even one case will end up having an outbreak. And that really speaks to, so what are we trying to do here now? We're trying to keep kids in school if we're going to have these outbreaks. And what does it mean in terms of quarantine? If right now we're seeing an average 60 to 90 kids quarantined in every one child that has an infection in high school, about 20 to 40 kids each grade school. And we're close to the end of the year anyway. And I think where you have B117 transmission right now, holding in-person classes is just not feasible and not recommended. Shouldn't be. Now, a lot of people are going to be against that. Again, remember, I was all for opening them up, but I see what's happening right now. The other thing that's occurring is you look at the epidemiology of the pattern of disease in our communities right now. Fortunately, in the United States, because of our level of vaccination, we've actually been able to really reduce transmission in the older population before we see more deaths. But we've seen a major expansion in the number of cases in those from their mid to 30s to early 50s. And many of them are the parents of these kids. Many of them are the family members of these kids. And the kids are transmitted in our communities. So I think that now is the time to say, look, we're so close into the school year. Why are we trying to force this to happen? When in fact, if we were to look carefully, we would see that, this is going to be almost impossible between the amount of transmission. It's so different now. Remember, our old recommendations were put together before B117 was ever on the screen. And so I think we need to do that. Two things are going to happen over the summer. We're going to get more vaccines, and for everyone, so every person in this country, and hopefully more and more people in your country will be able to get vaccine. And we're going to have pediatric vaccines. We're close now to having potentially 10-year-olds and older being vaccinated, and I think before long, well into early fall, it's very possible we're going to have vaccines for 6 months of age and older. That will help change so much. And in the meantime, let's not try to force something that's not going to work.
Right. So what about, I guess the question is, what's more important, the economy because, parents need their kids to be watched, or do you know what I mean? That's what it really comes down to, because to be quite frank with you, Mike, we've been told here in British Columbia that there are no transmissions in schools. And I know that maybe we're
Yeah.
the only ones in the world that don't have any transmissions in schools, but that's what we have been told here. Teachers are very outspoken, obviously. I'm a parent of a disabled child who's in the next room right now because I refuse to send him to school because I'm too worried. So I think that if we were to close schools, you're right. Other people would be angry that how are they supposed to work? I mean, how do we move forward and get through this yet be safe?
I think that public health and school-based officials were well-meaning in thinking that we could get these younger kids back in classrooms safely. And again, I just want to point out that some of the data we had, and Canadian data too, supported that point. But we have had one of what I would call a very unfortunate moment in the pandemic history, and that was the arrival of these variants. And when you look at B117 right now, I've been in this business 46 years. I've worked up outbreaks of all kinds, vaccine preventable diseases, you name it. Worked a lot with influenza. What I'm seeing happen with the spread of this new B117 strain in the United States is simply just mind-boggling. It's that much. And so it is so much more infectious than we've seen these other virus strains. Look no further than Europe. Find out what that means. They virtually have had to go in complete lockdown, shutting down schools, everything, just to try to contain the virus, even with a beginning of a vaccine campaign. The Brits are just now coming out of a 3.5-month lockdown in which schools were closed for much of that time. And that's what it took to control this. So all I'm suggesting is where we have B117 transmission. Right now in the United States, it's not common in every state. Some states may be able to get more time in. But where this takes off, and in your case in British Columbia with P1, need I tell you just what devastation that virus has caused in South America. In Brazil, we saw one of the scariest of all the situations occur in a city called Manaus, located in the far northwestern corner of Brazil at the headwaters of the Amazon. 2.5 million people in the city. And last spring, they had a major, major epidemic of COVID-19, such that mass graves. It was horrible. And they actually estimated that about 75% of the residents had become infected, such that they published several papers over the summer saying, oh boy, we don't have to worry about this anymore. We've hit this concept of herd immunity. Enough people are now protected. We won't see anymore. And then this new variant took off in November. And Manaus had a bigger outbreak the second time than they did the first time, of which many of the people who had been previously infected or in some rare studies vaccinated, we saw cases again. The deaths were up exceptionally high. So you now are sitting in British Columbia with P1. I mean, you don't want to mess with that. You want to do what you can to get vaccinated. You want to make sure you don't see it start to spread more. And most of all, you don't want it in your schools. So, I understand the need to get people back. I live with that in my family. With the 5 grandkids I have, I watch my son and my daughter and their respective spouses struggling every day to provide that care. But I also don't want to see any of the kids or them, seriously ill or die. And so all I'm saying is hold on a little bit longer. This is not forever. We will have vaccines for the world more and more, and I believe Canada will be there by this late summer at the latest, maybe much sooner for some areas. And if we can just hold out right now, that's what's going to make a difference.
Okay, I have lots more to talk to you about, but before we do that, I just want to mention that on this podcast, we like to give back, and we ask our guests to choose a charity that means something to them. And so for this episode, TELUS is giving $500 on your behalf to the charity that you chose, and that is the Battered Women's Support Services. And I know that they need this money, so I really, really thank you for choosing them.
Well, thank you for doing that. It's a very, very important cause.
It is so true. And I was going to ask you about that as we, I want to ask you about mental health because I mean, in my own circle, I'm seeing that, right? Like loneliness, anxiety, worry, fear, depression. It's definitely affecting everybody for sure.
Well, first of all, pay attention to mental health is very important. You can't diminish that. And there are ways to help address that that are in part, I think, to be left up to the creativity and the imagination of our individuals, ourselves, as well as our communities. I do a weekly podcast, Ghost Film Update, from our center, and we always have in that podcast a weekly act of kindness. And we talk a lot about the issue of kindness, and understanding, and support. And I can't tell you how much that has come to mean to so many people who come to get science-based information. But in the end, what they're really looking for is some kind of connection during this pandemic that allows them to feel just what you said. And let me just give you an example. This past week's act of kindness was a letter from a veterinarian in Hawaii who, as her primary job, goes around and is available to perform end-of-life services for pets, euthanasia. And in this act of kindness, the veterinarian talked about the fact that she was at a woman's home, helping assist with the euthanasia of her cat, who had a number of serious health problems. And the woman volunteered that all of her family had moved away, and this cat was really everything to her. It was so important. And as the veterinarian walked out the door afterwards, the woman kind of touched her on the shoulder and said, "Well, I suppose we can't hug them now." And the veterinarian said, "Yeah," and walked to her car. She got to the car, and the woman was on the front porch. She turned around and said, "Are you vaccinated?" The woman said, "Well, yes, I am." She says, "I'm vaccinated too." And they literally ran to each other, engaged and held each other in a most wonderful embrace. Now, you know what? That's an act of kindness. That's what we have to do more of. That's what we have to find out. How can we do these? And I think if everybody today woke up with the understanding, as much as it was important for them to breathe all day, they also have to find a way to do an act of kindness. And in some cases, even to themselves as an act of kindness. And I think that would begin to help right there, because rather than wake up every morning thinking how lonely I am, or what is it that I can't do today, or what kind of tragedy will I encounter today, wake up and say, I wonder what my act of kindness is going to be. Well, I've got this idea, I've got that. We have young kids writing letters and have become famous pen pals with people in long-term care facilities. I mean, I can go down the laundry list. So I want to say that it's not that there's any magic bullet to deal with the mental health issues. I mean, the stress of losing loved ones. So I think that all those things happen, but there's so much good we can do. And so, one of the other areas that I've been very involved with, I started a new fund, Frontline Families Fund, that here in the United States, it's part of the the Minnesota and St. Paul Foundation, and working with a foundation in New York to support 3,700 healthcare workers in our country who have died of COVID-19 by helping to support their families. Many of these are nursing assistants. They are not, doctors or individuals who have high income salaries or likely have life insurance policies. They're the people who make hospitals work. They're the ones that basically transport patients. They're there, cleaning in the environment to make sure that it's safe for people to be there. And, being able to help them by, first of all, just financially supporting them. We are making certain that every one of their children has a college scholarship, whatever age it is when they finally get to college age. And, this is the kind of thing we can do right now. So let's focus on these things. And so your gift to the Battered Women's Home shelter means everything to me. I came from a child environment where my father was a very abusive alcoholic. I, more than one occasion, thought when I found her, he had killed her. And, so to me, there's nothing that's more meaningful than to support women in need at that time. So you're right about mental health. I just want to say that. But you know what? We can do more. We can do more.
Yeah, and I mean it is a hard time, right? It's like for everybody. Nobody is left untouched here in how difficult this past year and a bit has been, and we're not done with it yet. Well, how did masks become so political?
I don't know.
Uh,
I mean, I say that with the idea that surely we saw in the administration here in the United States that that was something that the president was not in favor of.
well, it
Ironically,
trickled over the border. Thank you.
yeah, no, I think let me put it this way. I think it's been a tsunami around the world because it's been in many places. Areas in Asia, fortunately, have not had a major challenge with it, but a lot of other countries have, including in Europe and other areas. And it's just been an unfortunate situation that once it got started that way. I'm very concerned about another area that I think is going to be somewhat similar, and that is immune passport. This concept that I want to know if I'm on a plane next to somebody, are you potentially infected or not? Are you protected? If I go to a concert at X hall or some venue, am I sitting next to somebody who could be just breathing out all kinds of virus? Well, uh, what is it going to take to find out if these people are vaccinated, immune from previous infection, and whether the governments want to do them or not? The private sector is going to start doing them. And the question becomes, how do we do them so that they're accurate, so that they're fair, so that some people aren't stigmatized by them, meaning that I can't afford to get one, or that somehow I'm going to be prohibited from that. And so it's that's another area that I worry is going to
Mm.
become a very hot political
I've seen
issue
a
soon.
lot about the vaccine passport and that
Yep.
it's violating people's rights to have a vaccine passport. Um, so yeah, I see that wave coming also. I can see it on
Yeah.
social media.
And I think that's where we just have to have these really important discussions. I, for one, don't see it as a challenge from a rights standpoint. I willingly turned over my eyeballs and my fingerprints to clear the private organization in the United States that makes it possible to quickly get in through airports. And, that was my choice. Nobody made me do it, but I did. And so I think some people are asking, well, if we will, by choice, give up, precious medical information about ourselves so that some third party can verify that I'm really vaccinated or that, I have antibody, etc., all things which we still have to figure out what they mean. But the bottom line is, shouldn't I then be able to go somewhere and feel comfortable that I might be in an environment where I'm with like people? I'm with the people who basically also are protected. Wouldn't that make you feel better about wearing or not having to wear that mask if you knew that to be the case?
Mm. It's oh boy. Okay, so I also wanted to ask you before we look at, the next year and talk about that quickly. I What about people who say that if we were just healthy to begin with, if we all had enough vitamin D and we all ate nutritious food and we all weren't overweight and we all were just healthier, we wouldn't be at risk of getting COVID and we wouldn't be in this position right now.
Well, in fact, these types of conditions you just laid out do put you at an increased risk for having severe outcomes. And I know far, far, far too many younger, really healthy people who have died from COVID. So it's not as if somehow it's the answer, but it's one step. And so this is a time if you can deal with issues that you just talked about, make sure your chronic health conditions are being addressed, exercise, weight, all these things we talked about are real. But it won't be a magic bullet, and that's an important point.
So let's talk about the magic bullet as we head into the next year. Because if I talk to you 9 months from now, since we spoke 9 months ago, if I talk to you 9 months from now, where do you think we'll be?
Well, I'm hopeful, and I emphasize the word hopeful. I'm just reminding you that hope is not a strategy. But I'm hopeful that, in fact, we won't see the emergence of many of the variants that could compromise the protection of our vaccines. When I say compromise, I'm not saying it does them in, but it might reduce their ability to protect us. If we don't see that, and we do see ever increasing vaccine levels, and I unfortunately have to admit they'll be in the high income countries, I think life could come back to a new normal. It'll never be the same. but a new normal. We would be going places without masking. We would feel confident being back in restaurants and bars. We'd feel confident going to a party at our neighbor's house without wondering, I wonder if he or she is vaccinated. That would be great. That's going to depend on whether or not people actually will take the vaccines that we have and making sure that the vast majority of our neighbors and colleagues do take the vaccine. If they don't, we're going to see ongoing transmission. It's not going to go away. When you look right now, Minnesota and Michigan, the two states that have seen the big increase in cases, which I believe is just the beginning of what will roll through the United States. There we're talking about in the high 40% are vaccinated with at least one dose. That's a high number. And yet we're still seeing very, very widespread transmission. So we're going to have to get much higher even than that, even with the people who previously been infected, just in terms of protection. So if we can do that, if we can get at those high numbers, we can have a very, very different kind of fall than we've had in the last year. But if we don't do that, we got to hold on. We're going to still see more trouble ahead.
And what about the space between the two vaccines? So that's something that our provincial health office was the first to do it in Canada. Here in BC, I'm assuming it's because we don't have enough vaccines, and so to vaccinate people, and then it's now 4 months until your next vaccine. What are your thoughts on that?
Well, I actually was the first author on a major study that came out in early February recommending that very issue here in the United States. The data were compelling that after one dose of either the Moderna or the Pfizer vaccines, well over 80% of people had good protection. And that protection just increased with time. Now, you can surely get even better protection quicker with 2 doses, where at 3 weeks after the second dose, you're at 90% protection. But when you have a vaccine shortage, what's going to really save lives and minimize the impact on the community is how many people get vaccinated with 1 dose, just as they've done in England and just as they're recommending in Canada. With the idea the second dose is still to be had, but it can be spaced out. A couple of things to remember. First of all, when these vaccine studies were first set up to understand whether they protect people, they actually had the dosing at 3 and 4 weeks after the first dose to the second dose. That is a very unusual quick time to do that. If you look at most vaccines, the dosings are months and months apart because that's how the immune system works. You actually get more a boost out of an immune system that's been matured over time after an exposure. And so we always knew that we very well risked the possibility that the boosters wouldn't work that quickly. They did. That was great. But that didn't mean then that somehow if you didn't get your second dose at week 4 or week 5, you suddenly fell off the cliff and your protection was no longer there. So we were very strongly supportive of saying, do what they did in England. Instead of getting 50 million people vaccinated with 2 doses, get 100 million people vaccinated with 1 dose, with the second dose to follow this spring or summer when we had more vaccine available. And the Brits have shown clearly this was a very effective move. I commend the Canadians for it. I think maybe 4 months is a long time to wait, and they may not need to do that if they get more vaccine sooner. But I think they're doing the best they can to protect their country. I think the U.S. is going to one day regret not having done that, because just in the time period since our report came out, we could have, had we not been using 2 doses, vaccinated an additional 50 million people in the U.S., which with this B117 surge right now would be really critical.
So are your grandkids in school?
They are in school right now, and I think this is going to be a real challenge over the next couple of days to weeks, just with what activity is now happening here in Minnesota.
And the only reason I ask, Mike, is because, as parents and you would know this, and as a grandparent, these are the things you worry about, right? Like, am I making the right decision today? Am I making the wrong decision? My son's not seeing his friends, but is he safe at school? And so it's a real struggle, right? And
it is, yeah.
Do you think that we're in for more of these struggles as we move forward, like through the summer? just making these right decisions, play dates, seeing friends, hanging out. Like,
I think we are, and I think this is one of the struggles we continue to have. I know people want to get back to what it was like before COVID-19. We all do. No one sits there and says, oh, I love all these restrictions on my life. So what the bottom line message, though, is what's the price for doing that? And the price could be your life. That's the problem. So, we want people to live their lives as best as they can, as fulfilled as they can, but at the same time understand that these recommendations are not put into place to punish you. They're to help protect you.
I can't thank you enough for taking the time to speak with us again. You have your podcast, so where can people listen to your podcast?
They can go to our CIDRAP site, www.cidrap.umn.edu. And it's on the front page there, and it's posted every Thursday morning.
Awesome. And if you haven't read Mike's book, Deadliest Enemy, I highly recommend it. It's excellent. I do love it. I love your book. And and I really appreciate you for always making time for us. It's
thank you.
A pleasure to speak with you. And I like seeing you on TV all the time. It makes me feel a little bit better knowing that you've got things, when you're talking.
I appreciate you. Your manner of interview is remarkable. It's always to the point and practical.
Well,
and I think right now that's what we're looking for. We want honesty, but we want practicality too. So I appreciate your questions very much.
Oh, well, thank you so much.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.